Hello, and welcome to this informative video about why dry needling is an excellent way of treating myofascial pain syndrome. We have completed 2 systematic reviews analyzing the use and effects of this modality within 2 different populations, weightlifters and boulderers.
In this video, we will cover what dry needling is and the idea behind it. We'll also explain the effectiveness and how it compares to conventional myofascial pain treatments for the public and target athletes based on our review's findings.
Before we explain what dry needling is, we have to mention what myofascial trigger points are. Trigger points are hypersensitive spots at multiple points on the body. These taut bands of skeletal muscle under direct compression or muscle contraction can elicit local tenderness, local twitch response, and referred pain, which usually responds with a pain pattern distant from the spot.
These irritable spots can be the cause of multiple common complaints, such as a headache that originates from the trapezius muscle or pain in the lower extremity that is generated by the gluteus muscle. These issues can be familiar to anyone from a sedentary office worker to a professional athlete. It is common to treat these complaints through massage therapy or ultrasound to relieve tension in the muscle. If done in combination with stretching exercises, these can be useful tools.
So what is dry needling? Dry needling is a method where a small needle is used to deactivate irritated trigger points to relieve pain. The dry indicates that no fluid is injected during the process. It is simply the needle that does the work. The most common way to execute this treatment is described by C.Z. Hong.
After locally disinfecting the area, the needle is inserted into the trigger point of the muscle. This is followed by a quick pull-out and is repeated 5 to 10 times. With this method, the needles don't stay inserted into the skin for long, and this helps avoid any unnecessary damage to the skin. Because of the slightly invasive nature, we went on to do our own research on how dry needling is compared to other conventional methods of treatment for trigger points.
Climbing and bouldering are forms of mountaineering. The athlete will attempt to scale or climb a near vertical surface. Rock climbing can be differentiated as higher slopes, where athletes use harnesses, while bouldering involves no physical protection. However, the slopes or climbing walls are significantly smaller, presenting less risk of injury.
Common to these sports are overuse injuries. According to Robro et al., these are usually overuse injuries in the upper extremities. Considering that these subforms of mountaineering are non-contact, most overuse injuries are muscular.
So we set out to find out which treatment methods commonly used by physios are the most effective at treating these types of injuries, as specific to bouldering and climbing as possible.
For the first review, after the screening procedure, 6 articles were included. All 6 articles used a method of dry needling therapy as an intervention treatment modality. These studies showed a variety of control treatment methods such as trigger point compression, drug therapy, electrotherapy, sham needling, taping, and a mixture of dry needling and electrotherapy. 4 out of the 6 articles showed dry needling had significantly greater treatment effects with regards to pain treatment. Dry needling was compared to various invasive and non-invasive treatment methods and overall had a superior result when treating a form of pain.
Based on this review, we indeed found that dry needling is not only effective at treating myofascial pain syndrome, a common injury in climb sports, but it is even more effective than conventional methods used by physios.
Weightlifting is a sport in which athletes compete in lifting a barbell loaded with weight plates from the ground to overhead, with each athlete trying to successfully lift the heaviest weights. Athletes compete in 2 specific ways of lifting this barbell overhead: the snatch and the clean and jerk.
Weightlifters are no exception to myofascial pain syndrome and shoulder problems. Up to 36% of weight training sports injuries occur in the shoulder area. The shoulder complex is highly mobile, and with that also comes an increased lack of stability if undertrained, leading to injuries like tendinitis, rotator cuff tears, and also myofascial pain.
The main goal of this review was to compare dry needling with massage therapy and other treatment modalities.
For the second review, after a screening procedure, 8 articles were included. All 8 articles used the method of dry needling therapy as the intervention treatment modality. The studies show the variety of control treatment methods such as massage, stretching, sham needling, a combination of needling and others, and even dry needling itself with different application methods. Dry needling, although it is an invasive method, can be viewed as a great intervention for trigger point treatment, as 6 out of 8 articles showed significant improvements compared to the control group. In all 8 cases, dry needling showed significant improvements when looking at primary outcome measures compared to the baseline reports.
Based on these findings, we can conclude that the highly effective properties of dry needling therapy can be applied to amateur weightlifters. In conclusion, dry needling, according to our research, is shown to be significantly more effective at treating pain in trigger points than conventional therapy options, such as massage and others.
Both reviews show, despite the invasive manner, a high effectiveness rate.
When considering needling, based on our reviews, we can recommend to complete the sessions in the following manner. Use the Hong method for a fast in and out puncture. Multiple sessions should be introduced between 2 and 4 times. Each session should be at least 20 minutes, with the total treatment period lasting for at least 1 month. Additionally, stretching could be considered in combination to achieve more improvements.
We are glad to bring forward this information and hope that it has been informative to patients and physiotherapists alike.